Okay, so we're going to do the 12 lead EKG. So if you can't see the screen, I mean, you can look right there, you can look on your computer. But this is important that you see what's going on. So like I showed you before, and this is in your book. I don't know if it's the same exact one, but this is what a 12 lead EKG strip looks like. So if you look to the left, from top to bottom, you see the three bipolar leads. Lead 1, lead 2, and lead 3. So those are bipolar axial limb leads. There's 6 total, 10 electrodes. Remember before I told you that we do not use the right leg electrode for leads. We use that as a ground. So these are the augmented limb leads, AVR, AVL, and AVF. So these are just little samples. Of course, this isn't a 6-second strip. So you can see the waves, you can see the beats in each of these limb leads. All 6 limb leads are there on the left. To the right, you have your 6 chest leads, V1, V2, V3, V4, V5, and V6. Then the EKG machine will give you an extrapolated lead 2, because which is the best limb lead to look at? Let's face it, lead 2. You'll see why. Now there's this little box on top. I might have mentioned this last time you see this. This is a calibration. So it's 2 big boxes in the vertical y-axis. So how many millivolts is 2 big boxes? 1. Just 1 millivolt, right? So it calibrates it to 1 millivolt in the y-axis. So they're just samples. Again, even the bottom one is not a 6-second strip. So let's just look at some apparent things. And I think your book will give you a nice way to look at it too. So the first thing I look at is lead AVR. And what I'm looking for is that wave and the QRS, is it negative or positive? Negative, right? And that's completely normal, because we're not looking at the left ventricular wall here, obviously. So AVR is negative. That's cool. Then let's look at lead 1 and lead AVF. Lead 1, is it positive or negative?
Positive.
Lead AVF, positive or negative?
Positive.
Good. And that's normal axis, you're going to find out if you were listening before what axis is. And it's only, axis is only seen in the axial plane. Makes sense. In a frontal view, a frontal plane. Then we could do all the other fun stuff. Now, I mean, we could look through, let's just do rhythm. Is there P waves? Yes. Followed by normal QRSs? Yes. Is the rhythm regular? Yes. If I use my calipers, of course, or a piece of paper, I could see that that rhythm is regular. And this is lead 2. What's the heart rate? Let's do the 300 method. Let's find, even right here, I could do it. I can go up here, find one quick. So 300, 150, 100, 75. So the heart rate is between, say it, 75 and 100, right? And is that normal ventricular heart rate? Yeah, right? So what rhythm is this down here?
Sinus rhythm.
Normal sinus rhythm. Everybody agree? Well, that's a good one. Then we can go over now, we can look a little deeper into this. We can go over to the chest leads, and these are transverse leads. These are heart leads or precordial leads, horizontal leads, all means the same thing. All right, so we're looking at different planes. Now we're looking down in the transverse view, which you'll see. But let's look at the waves, see if we know what's going on. V1, is that negative or positive? Good. V2. V3. Positive. Good. V4 is positive, V5 is positive, and V6 is positive. So where's the transition from negative to positive between what 2 chest leads? So it's between V2 and V3. Remember for later that the normal transition in this transverse plane should be between V3 and V4. That's where it should go from V3 should be negative, V4 should be positive. So that's where it's going to switch, V3, V4, hopefully around the interventricular septum. So you're going to look at a lot of these, and you look at the different leads. If you look at AVF, we said it was positive. AVL is kind of isoelectric, because that's the part of the heart that's kind of further away from the main depolarizations. And AVR is negative, normal. This is just a close-up of the lead 2 in the same patient. Same thing. Here's a close-up of AVR, negative deflections. It's all the same heart rate. You know, this is all ventricles, right? This is not atrial heart rate. This is ventricular. This is not an AV block. Lead 2, we saw an AVL looks isoelectric. By the way, we're not going to do page 53 in your book. Question?
Yeah. So for the other, what's called example we were looking at, it was negative at V2 and then positive at V3. So that's not normal, right?
Yeah, that's not normal.
Okay.
Yeah, it's supposed to be between V3 and V4. And you'll see what that means. So I'll tell you this, like when you're looking at the 12 leads, when we're looking at this side, the 6 limb leads, we're looking for axis. And if they're normal axis, or is there axis deviation, right or left? When we're looking at the chest leads, we're looking for rotation. Is there leftward rotation of the depolarization, or is there rightward rotation? So in this case, you're going to find out that this is rightward rotation. So it's a little off. So rotation basically has to do with, and both of these really, axis and rotation are looking for hypertrophy most of the time. So always remember, depolarization goes towards hypertrophy and it goes away from infarction. So if you have dead cells, the major depolarizations are going to be somewhere else, and you'll see what that means. So yeah, that is abnormal. Good point. We don't use the sagittal plane, but the transverse is the chest leads, precordial, horizontal, cardiac leads, whatever you want to call them along those lines. All means the same thing. Frontal is your axial leads, your limb leads, coronal leads, but most of the time we say axial or frontal leads, and limb leads. There are limb leads. And this shows you both. This is an axial, this is the hexaxial diagram that's showing all the leads that are in the axial plane. Like, yeah, does it show all of them? Yeah, they're all here. So you're going to see where lead 1 is. And remember one thing, if you missed this before, the positive electrode is usually where the arrowhead is. And that's what we're looking at. And then again, this is the right ventricle, this is the septum, and this is the left ventricular wall, which is thicker. So we're going to look at all these degrees, and they're 30 degrees in between each vector. So each lead gives you a vector, and there's 6 vectors, all with a negative and a positive electrode. Okay, so the bipolar leads are lead 1, 2, and 3. The unipolar leads are AVR, AVL, and AVF in the limbs. Okay, so it's all based on those first 3 leads, all of this. So over to your right, you see the placement, which you should learn, where you put the electrodes for your precordial leads. And you'll see 4th intercostal space, parasternal to the right is V1. V2 is the opposite side. Parasternal, 4th intercostal space. Now, what we usually do after you put V2 on, you put V4 on, which is midclavicular in the 5th intercostal space. You split the difference and you put it on V3. It's like right in the middle. Everybody kind of understand that? You try to stay off bone, but it's hard to do in that spot. V5 is anterior axillary, 5th intercostal space, and then V6 is mid-axillary, almost all the way under the arm. Way to the left, right? So we're looking more at the left side of the heart when we see V5 and V6, if you heard before. V1, V2 is more right side of the heart, in the horizontal plane. And here's what you're looking at. Now you're looking from the top down when you look at that little picture there. V1 starts on the right, V6 is all the way on the left. And where should the transition be, positive to negative?
Between 3 and 4.
You got it. Looking for abnormal rotation. So here it is, here's the placement. These are all the chest leads, precordial leads, which are going to be horizontal leads. And then your limb leads. And then is this modified or is it standard?
Standard.
Right up. So this is a normal 6-lead EKG readout, and this will tell you where to put the electrodes. There's 10 total. And also the right electrode, the right leg electrode, right, which is green, that's just the ground. So remember, green ground. It's not really reading anything. So the left leg is all the inferior leads go to the left leg. You're never going to say, so the point is you're never going to say, what's the negative, where's the positive electrode? The answer is never right leg. And so either the two arms or the left leg. So you just remember that for later, which it says in your book. So let's look at this EKG. Lead AVR, is it positive or negative? Yeah, I'm happy. Lead 1, positive or negative?
Positive.
Lead AVF, positive or negative?
Positive.
So both lead 1 and AVF are positive, and that's going to be significant later. Let's look at rotation now, which you don't see from this side. The left side is all axial. You can only see axis. Let's look at rotation, if there's proper rotation. V1, negative or positive?
Negative.
V2, V3, more negative. That's a tough one, right? That's a tough one. V4, more positive. So we got a good transition, normal transition, no rotation. So no leftward or rightward rotation. And of course, after V4, there's going to be positive because there's no rotation issues. Yes?
For the leads for V1 through V5, they would have to be facing towards the heart, right?
V1 through V5?
Yeah.
What do you mean towards the heart?
Like when you put the lead on, the wires have to be facing towards the heart.
The electrodes?
Yeah.
Well, the electrodes are going to pick up the depolarization. So technically, the leads are looking at the heart and picking up the depolarization through the skin. So basically, yeah, you're kind of looking at that part of the heart. Like this is more right ventricle, this is more left ventricle. I think that's what you're asking, right? And look at the way it is here. Now look, left ventricle. Now you're looking from the top view because this is the horizontal plane over here. So look at where the positive electrodes are, and that's what that means. And with the horizontal leads, you can see more anterior heart too, right? And posterior actually. With the limb leads, you're looking more lateral or inferior. Make sense? And you'll see that. You'll see that. Again, I'm going just slowly trying to go through all this. So hopefully you read Dubin. You have an idea what's going on as far as how EKG works and what Einthoven's triangle is. And that's based on the bipolar leads. That's how they found out how this works. So this is a great picture to draw over and over for your limb leads, 6 limb leads. You should be able to draw that at 30-degree angles and know where the leads are. So here's the key. Where the arrows are pointing, that's the part of the heart you're looking at, and that's the positive electrode. So every time you draw an arrowhead, like lead 1, you put a positive sign. Lead 2, positive sign. 3, positive sign. AVR, positive sign. And AVL, positive sign here. AVF, positive sign straight inferior. So if you look at this plane, which of the bipolar leads is the only lateral lead? 1, 2, or 3? Which one is showing the lateral heart as opposed to inferior? 1, 2, or 3? 1. Very good. Very good. That's not easy. So the negative electrode is going to be on the right arm. Positive electrode is going to be on the left arm. What about lead 2? Inferior or lateral? Very good. Lead 3? Inferior. So the only lead that's lateral on of the bipolar is lead 1. So those are the 3 basic leads. AVR, AVL, and AVF are augmented leads that the machine does. Because remember, you're only really using 3 limb electrodes technically, and you only put 4 on. So 10 electrodes, 12 leads. And the right leg is just a ground. So this whole electric depolarization direction was found by running those bipolar charges through the skin, and sodium influx is really what they found. So lead 1 is going to go negative on the right arm, positive on the left arm, like that, right? That's the direction, lateral, on the right to left. So it's looking at the left side of the heart more, lateral. Then lead 2, which is the best one, is going to go right through the ventricle, right? Pretty, not dead center, but pretty close. So the negative electrode is the right arm. Positive electrode is which leg? Has to be, can't be the right. Excellent. Lead 3, left arm to the left foot. So you don't say right foot, right? Negative electrode for lead 3 is the left arm. And there's great exercises in your book. So these all crisscross, and these are the augmented, but even the lead 2 goes this way, lead 3 goes that way, lead 1 goes that way. They all intersect at the, which node? I said it before. Which node do they all intersect at? All the leads. The AV node, right? Because it's right above the ventricles, between the atria and the ventricles, atrioventricular node. Okay, so this is from Dubin, I think. This is the actual hexaxial, sorry, and all the parts of the heart you're looking at. So if you're listening before, what is that big arrow, the rainbow arrow? What do you call that? Really important. What do you call that rainbow arrow? Well, the way I explained it, you see all these black lines, and this is just the ventricles, really. Mostly the ventricles. All the black line is vectors of depolarization within the myocardium. So if you take the sum and the average and the direction of all those depolarizations, the main one is the mean QRS vector. So you have to know what the mean QRS vector is, or you can't go any further. Okay, that's where most of the depolarizations are going. And if you look at it, it's going through what part of the heart? Now remember, this is the frontal view. What part of the heart is this going through? Yeah, left lateral wall of the ventricle, which is the thickest. And what lead is pretty close to that? Not exactly, but pretty close. Lead 2. So lead 2 is the best lead to look at for this reason in the limb leads. Which lead did we look at first when we looked at the 12 lead EKG? Like when I first looked at the 12 lead EKG, which is the first one I looked for to see that it was negative? You remember? It was AVR. And look where AVR is looking at. That's way on the right, complete opposite of the mean QRS vector. And this is normal. This is what mean QRS vector is normal. That's a normal thing. That's good to know. There's no pathology. This is exactly what it should be. So AVR is the opposite direction of the mean QRS vector. That's why it's negative. So that's a healthy heart. You're getting most of your depolarizations along that left lateral wall, and that's why we can use lead 2. That's the best one to look at, not AVR. Okay? So I mentioned before lead 1, and you told me it was positive on the first one, and it was. Lead AVF, that was positive on the first one. So that is a complete 90-degree angle between AVF and lead 1. So if the mean QRS vector is where it's supposed to be, lead 1 is going to be positive because it's close. Lead AVF is going to be positive, and you're going to have normal axis. If you're in that, especially in that lower quadrant, that's 0. They say 0 to like 110, because you have to allow for different shaped people. Like a vertical heart goes straight down, so they might have a little more room going to the right axis deviation. And if somebody's really big, it's going to go up more to the left. So you'll see in another slide how there's a little bit of leeway. So again, we're not doing page 53, so there's like 3 or 4 slides I have to skip on here, because we're not gonna use the protractors, we just don't have time. And it's really an easy way to do this. You know what the hard part is? When you go from like axis to rotation, you go from the limb leads to the chest leads, and you get confused. So that's why I went really slow. You say, okay, we check axis with the limb leads. We look at lead 1 and AVF. For rotation, we look at the chest leads. Make sure the transition from negative to positive is between V3 and V4. Okay? And you should be able to draw all this, but you should be putting arrows with arrowheads, like this is the positive lead. So if I asked you, AVF and AVR and AVL, a little strange. I don't like to ask the negative electrode, but let's say I asked you, what's the positive electrode for AVF? Where would that be? What limb?
The left leg.
The left leg. It's the inferior lead. If I asked you what's the positive electrode for AVR, what would you say?
The right arm.
The right arm. And AVL would be the left arm. So the negative lead, negative electrodes in the augmented leads, AVR, AVL, and AVF, you're gonna have to fill it in. So what you put in, like AVR, positive electrode is the right arm. So the negative electrode is both the left arm and the left leg. It's kind of in between. That's what you answer there. But I probably would never ask you that on the test. But you better know that where's the negative electrode for lead 1? Might not know it now, but I'm not trying to put you on the spot. But what do you think? The positive electrode is the left arm. Where's the negative electrode for lead 1? The right arm, right? It's straight across. It's a lateral lead. We talked about that before. Confusing, I know. Where's the negative electrode for lead 2? The positive electrode is on the left leg,
The right arm.
the right arm. Where's the negative electrode for lead 3? The positive is on the left leg, which you told me.
The left arm.
The left arm. So those are the kind of questions you got to go through in your book, and those are the quiz questions. So just repetition. But remember, this is axis. This is limb leads. This is frontal plane, axial. So that was all this view. We don't really use this. So transverse is going to be your chest leads, horizontal, because now you're looking transverse down at the heart. It's a different view. Everybody kind of see that? Like, there might be a picture here, like Dubin does a good job with like cutting the body in half, you know, where you could kind of see it a little bit better so you can see what view you're looking at. And I think he puts a car in the book too, which like, so when you're looking at all the different angles when you're buying a car, like you can see the back, you can see underneath, you can see the front, because you can't see that at one time. So the EKG gives us a bigger picture of what's going on as far as depolarization in all areas of the heart. So now we're into the transverse leads, the chest leads. So know the placements, right? We talked about that. And these are kind of simple because the positive electrodes are all in the front. And these negative electrodes are all in the back. That's it. Front and back, anterior, posterior, however you want to write it in. Okay? So that's a lot simpler than the limb leads. Okay, excellent pictures here to show you where to put the electrodes. And this, again, we're looking at the top of the heart. And all of these are, again, go through the AV node. That's your intersection point. So V1 and V2, what are you looking at? The right ventricle or the left ventricle?
The right ventricle.
Yeah, so V1 and V2 is showing you more of the right heart. And you could have an argument, some books say also anterior and posterior. But for our purposes, we know it's on the right. And what about V3 and V4? What part of the heart is that going through?
Interventricular septum.
Yeah, more septal. But again, you could have an argument, some books say anterior as well. But for us, let's learn it this way so we know rotation. So V1 and V2 is right side of the heart. V3 and V4 is septal view. And that's where your transition is, remember? Between negative and positive. V3 should be negative, V4 should be positive. That would be no rightward or leftward deviation in rotation. Rotation, rotation. Because we're not talking about axis anymore because we're looking at different leads. That's the confusing part, believe it or not. But what about V5 and V6? What is that looking at?
The left ventricle.
Mostly left ventricle, anterior wall, and part of the posterior wall too. So which chest lead did I say was the best to see, the best V5, right? And that's why. So V5 should show you a nice upright QRS with an R wave that's positive. You have an argument, you might see one a V6 that looks better. I see that more than not. But that, just know this, the V5 and V6 is looking at the left side of the heart, the left ventricle. This is really good because it shows the transition and exactly where the negatives are, the positives. So the arrows I would put arrows here too. So look, V1 negative, V2 negative, V3 more negative, V4 all positive, positive, and positive, V4, 5, and V6. Because you're looking at a thicker part of the heart. And that corresponds with the mean QRS vector from the axial plane. If you think about it, that's why V5 is the best in the chest leads, and lead 2 is the best in the limb leads, to see a nice upright QRS that we like to see. This is the waves of depolarization, how they start. So from the SA node into the bundle branches, now the left side depolarizes first. Remember this, I mentioned this before. Depolarization happens from the endocardium into the wall, starts on the left. So right here, you're gonna have that, there's not much going on right here right now, so you can have a little negative Q wave. You don't have to have that, right? In fact, a really large Q wave could signify an old myocardial infarction, scar tissue, right? So then it travels down the bundle branches, the left and right bundle branches, depolarization, and that's where you get a nice boom. You get the height of the R wave, the most positive part of the deflection. And then it has to go up, right? Because the blood is getting pumped up. So the heart's squeezing in that syncytium upwards, systole, depolarization, systole, upward. So then you might get a little S wave there. And that's part of it, and that's at the end. So when it's really further away from the mean QRS vector, which goes right through here, right through here, about 45 degrees. This is hard to understand, but what this is showing, the blue lines are your mean QRS vector. So this is where we like it, right? This is completely normal. But if it goes here a little bit, it's going to go more towards lead 1. So lead 2 is going to be a little less positive than it would be if the mean QRS was here. And now we're getting further away from lead 2. And now we're completely opposite almost of lead 2, not there yet. And this would be, AVR should look like this, not lead 2. So if you see this in lead 2, you got a problem, right? If you have a negative wave like that. Because in lead 2, say there's an infarction in the left lateral wall, left coronary artery, left anterior descending artery, then depolarization goes away from infarction. So it's going to shift to the other side of the heart to try to pump the blood out, right? Because dead cells can't work. So depolarization goes towards hypertrophy, away from infarction. So that's kind of hard to understand, to tell you the truth. So here's something you should be able to draw every time. You draw the heart. You have the ventricle, thick ventricular wall, the septum. This is the AV node, point of intersection. And what I would do is, the first thing I would do is draw, what's this lead that goes straight down? Inferior limb lead. Now this is all limb leads now, because we're in axial. We can't get chest leads from here, right? This is limb leads. AVF, right, because that's the one that has the negative electrode between the right and left arm and the positive electrodes on the left leg. And what's this lead going straight across? Positive electrode here.
Lead 1.
That's lead 1. So that helps us decide what axis we're in. And then, of course, put the arrowheads, put the positive sign and the negative sign. And know this, below 0, down in this quadrant, the numbers are positive, 30 degrees in between, 30, 60, 90, 120, 150, 180. And on this side, they're negative, negative 30, negative 60, negative 90, negative 120, negative 150, and this one could be positive or negative. So you know there's 30 degrees between each lead, right? And again, we're not going to use the protractors. We're not going to do page 53. And there's probably a bunch of slides we're not going to see. So once you drew in all the leads, all the arrowheads, the positives and the negatives, then you can put where you think the mean QRS should be. Follow me? And then you can, and if you look at lead 2, you're going to get a beautiful QRS complex, if that's where the mean QRS vector is. So the problem is the mean QRS vector could deviate out of there. So this is that extra, I like to stay in this tidy quadrant, right? Because you got lead 1 and look at lead AVF. That's the easy way to do it. If you do the actual degrees, you're plotting, it's really a difficult thing to do. It takes a lot of time. Then you just have to make sure the numbers between 0 and 90, or between, I should say, between -30 and 110. And you should know this. So this gives you a little leeway outside that quadrant in case you have that tall guy with the vertical heart. Because you don't want to call it right axis deviation if it's within this range, right? It's still normal. If it's in the gray area here, it's normal. Normal axis, you would say. Remember, this is limb leads. That's where you get lost. And for the big guy with the huge diaphragm and the horizontal heart, he tends to be shifting to the left. So that's why they give them that extra 30 degrees to say that their heart is in normal axis. All right. But how are we going to do it? This is how we're going to do it. We're going to look at lead 1 first. And what did we see at lead 1 first on that book picture? Is it positive or negative? Positive. It was positive. Then we looked at lead AVF. Was it positive or negative?
Positive.
It was positive. When you have AVF and lead 1 are positive, both positive, that's normal axis, period. So if the mean QRS vector drifts over here, then you're going to have a positive lead 1, but lead AVF may be negative. So if lead 1 is positive and lead AVF is negative, that's left axis deviation. That is a graph coming up. But you have to see why. And remember, this is limb leads, axial plane. Now, if the mean QRS vector is over here, now what are you going to see? Now we're further away from this electrode, the lead 1. We're closer to AVF though. We're close to AVF. So in right axis deviation, lead 1, negative. Lead AVF, positive. Because it's still close to AVF, but it's way away from lead 1. So that's right axis deviation. It's not normal axis anymore. Now say the mean QRS vector is up in here, way to the right, completely opposite of where it should be. Then lead 1, negative. Lead AVF, also negative. So if they're both negative, lead 1 and AVF, that intersection leads, that's extreme right axis deviation. Okay? This is really good because, again, it shows the arrows now. I like that. And there's your normal axis. And it's all about the mean QRS vector in the ventricles. So it's mean QRS means it's ventricular depolarization. Because what you're going to see when we do rhythms, that the atria depolarize themselves. They have their own P vector, P wave vector, right? So they have a mean vector too. But we're just talking about the ventricles today. And next week when we do rhythms, you'll see that the atria can have a problem with this as well. Know the numbers. Negatives on the top, positives on the bottom. And here's the graph that you can use. Normal axis, lead 1 up, lead AVF up, right? In right axis, left axis deviation, lead 1 positive, AVF negative. In right axis deviation, lead 1 negative, AVF positive, because it's further away from where it should be, further away from lead 1. In extreme axis deviation, lead 1 negative, AVF negative. Way in the wrong place. So what does all this mean? And really, between rotation and axis, basically we're looking for hypertrophy of the ventricles, because depolarization goes towards hypertrophy, away from infarction, in case that's the problem. So if you have a left lateral wall myocardial infarction, axis is going to shift to the right. Or if you have a problem with the left side of the heart, the right side is going to work harder, and you're going to have hypertrophy. Or if you have pulmonary edema, you're going to have right-sided hypertrophy. And it'll show up on axis. We didn't even look at rotation yet, which is even simpler. Okay, but you have to know why, really. You have to know where the mean QRS vector is. Is it close to lead 1? Is it in between lead 1 and AVF? Is it far away from lead 1? Okay, and that's what this is telling you. Now, we could have plotted this out by using isoelectric lines and getting the actual number and seeing where it fits into this range. So technically, you should know these ranges. It's a little memorization. Take it slow, though. Learn it, the positive and negative 1 and AVF first. Okay, so let's look at this limb lead half. Remember, this is only 6 leads. You don't have the chest leads here. Axial, frontal. So lead 1, up or down? Positive or negative? Lead AVF. Lead AVF, negative, or you can't see it? It's negative. Sorry. So what do we have here? Yeah, left axial deviation. If AVF was up and positive, what would we have? What would you say? Normal what? Not axis deviation, you say normal axis. Okay? And AVR, is that okay being negative like that? No problem. So what do you think you have here? What's the condition of the heart? You think you're worried about infarction or hypertrophy? Tough question. Well, the mean QRS has drifted more to the left, and depolarizations follow what? They go towards what? Hypertrophy. So what side is this deviation to? Left or right? In this one, AVF is negative. And one is, it's left side, right? So lead 1 is positive, lead AVF is negative. That's left axis deviation. So we have left ventricular hypertrophy because the QRS vector is going more towards the left. And that's where most of the depolarizations are. And depolarization goes towards hypertrophy. Okay? This, we're going to skip these. This is how we plot it. We get an isoelectric line. And you have to count amplitudes and plot out the actual angle, right? So that would be a normal axis there. But we're not doing this. It's only one page in your book, right? Because all you have to do is look at 2 leads in the axial plane for axis. Now this is not axis now. Now we're looking for rotation. We're going to see if the part is in the right position, and this also can show hypertrophy. So again, you look, where's the transition from negative to positive?
Between 3 and 4.
Good. Same thing here. This is not shown. This is really weird because you're looking at the bottom of this guy's body. He's laying down. You're looking from his feet up. So this is the right side. This is the left side. So nothing special here. But I like this thing on the bottom, the Spanish writing, where I showed you before. Where V1 and V2 are right. V3 and V4 are septal. V5 and V6 is left ventricle. That's something you got to live by. Okay. So let me go back to the first one. And you have plenty of practices, and I'll send you practice EKGs, but now you're going to get into rhythms next week, which is a whole much more difficult situation. You guys have any questions now? You feel kind of comfortable with this? What the difference between limb leads and chest leads? Axial versus transverse. Sorry it's taking so long. Okay, so let's look at this EKG again, which we looked at, the first slide we looked at. AVR, positive or negative? Negative. Is that okay?
Yeah.
And you know why now. Mean QRS vector is where it's supposed to be, for the most part. Lead 1, positive or negative?
Positive.
Lead AVF, positive or negative?
Positive.
So what do we have here?
Normal axis.
Normal axis, because both are up. That's all you have to do. And we saw before, if AVF was negative, it was left axis deviation. Okay, let's look for rotation now. V1, is it negative?
Yes.
V2?
Yes.
V3?
No.
No, it's positive. So the transitions between V2 and V3. V4 positive, V5 positive, V6 is positive. So where's the transition between V2 and V3? So which way is the rotation?
Right.
It's rightward rotation. Because remember, you told me V1 and V2 is looking at the right side of the heart. If the transition was here between V5 and V6, or even V4 and V5, that would be leftward rotation. So this is rightward rotation. That's not exactly normal. Unless he's a really tall, thin guy, right? So what side of the heart has hypertrophy? Left ventricle or right ventricle on this one?
Right ventricle.
This is right ventricular hypertrophy, possibly. So then again, you go on to look at lead 2, you look at to make sure there's a sexy P wave followed by a normal QRS complex. You make sure the rhythm is normal, and then you could do the heart rate and call this normal sinus rhythm. So next week, you'll learn all the inherent cadences of all the foci, like sinoatrial, SA node, atrial cells, junctional, which is AV node, and then your ventricular rhythms. And see where that rhythm is coming from, based on the P wave, based on the QRS interval, and the PR interval you need to know. So remember the PR interval, and is it consistently between 0.12 and 0.2? Does it change? So that's the kind of thing you have to look at next week. All right, so the last thing I want to show you is the bundle branch blocks. And what side you have the bundle branch blocks on. I know you guys didn't hear this because I think you're on your way here. So now what you see, like this is a good one. Everybody can you all see this? It's like the R wave has rabbit ears. So there's 2 peaks in that R wave. So the 2 R waves. And we call that R, R prime. The first one left to right is R, and the next one will be R prime. So this would be the rabbit ears one way, this is another. So that shows you there's a bundle branch block. And then be clear on your books, in your books. Dubin does a great job, and they practice EKGs that you get. So you see this one here? I could see that. Can you see those 2 peaks, R and R prime? And this is lead 6 you're looking at. You're looking at lead 6. So you have to look at every lead to see if they're normal. So which bundle branch is blocked in V6? Where's V6, left or right heart?
Left.
It's left, V5 and V6. So this is a left bundle branch block. All right, V1's okay, I don't see it. So then if you go over here and you see this is 2 peaks right here. This one I don't like, this is a little more difficult. I'll give you this. And then you can see this here too, basically. So this one is where your bundle branch block is. So if it's V1, is it right or left bundle branch block?
Right.
That's a right bundle branch block. So, you know, you have to see it, you have to know what's going on. So basically what's happened is the left and right ventricle are depolarizing at different times. So that, of course, that's going to mess up your cardiac output. So there's no good connection between the left ventricle and the right ventricle. So here's some here, the red circle, this one here, you see that? That's a good one. You can see it there. And that, what lead is this? V2, right?
Mm-hmm.
So that's a chest lead. They're not even showing us 4, 5, and 6. They're just showing this. So which bundle branch block is this based on V2?
Right.
Yeah, because that's V1 and V2 is right side of the heart. So that's all you really need to know for that. Here's one here. That's hard to see. Again, I'll give you a better one if I can. But that's a bundle branch block. In V6, it's showing up. Showing up in lead 1 too. Showing up in lead 1 as well. So over here, which side would this be? V6, right or left heart? Good. Good. Okay? So there's your Dubin pages, 191 to 198, which is on the back of all the PowerPoints. Okay? Anybody have any questions? So I promise you we'll get to put the leads on again. You'll be able to do a 12 lead EKG. We'll make time for that. Because the bad news is we're probably not going to do stress tests a lot. Maybe we'll get more.